Hi, Mr. Rangel here. We're going to be talking today about anatomical terminology. Here's one reason why anatomical terminology is so important. Even understanding the terms right and left can get you in trouble. There's a story back in 1995 about a doctor in Tampa. He was a surgeon, and there was a patient who had two diseased feet. Both of them looked really diseased. Well, the left foot needed to get amputated, and the right foot wasn't quite that bad. But the chart said amputate the left. Well, lo and behold, some of the material got transcribed wrong. And so on the board in the surgical wing, where they write down all of the surgeries, it was written down incorrectly. And so the surgical nurses, they actually prep the patient to get the right leg amputated. So the doctor comes in, amputates the wrong leg. And he actually found out halfway through the surgery. A nurse was looking through the notes again and saw that it was supposed to be the left leg. But he was halfway through it, he had to finish it. So understanding the right and left, first of all, you need to understand that we always look at things from the patient's perspective. So right here, this golfer, this is her right side. She has a right leg that's amputated, and here's going to be her left side. So this would be her right arm, this would be her left arm. If this is a diagram of her heart sitting in her chest this way, this would be the left side, and this would be the right side. Earlier in class today, I had everybody touch the front of their forearm. So can I have you touch the front of your forearm right now? You might either be touching here, or I bet there's a good chance that you're also touching here. We need to agree upon the same anatomical position. And so that's what we see over here on the left. The correct anatomical position is always going to have the palms facing forward and the thumb, which makes the thumbs face out, and with the arms just hanging gently at your side. When we describe directional terms, we always need to know two things. Number one, what thing are we trying to describe? And number two, we need a reference source. So you can't just say superior. You have to say superior referencing to what? So what is your point of reference? So you could say that the eyes are actually superior to her cheeks. The reference point there would be your cheeks, and since her eyes are further up, we would call them superior. That is a directional term that just means above. The opposite of superior is inferior. We could say the lady's mouth is inferior to her nose, and in that case the nose would be the reference point and the mouth would be the structure that we're trying to describe. Okay, also imagine you see this midline right here running right down the middle of her body. Well, the closer an object gets to that midline, we call that medial. So whenever a person is standing in the anatomical position, the pinky finger would be the most medial of all the fingers. Opposite of medial is going to be lateral. The most lateral of all the fingers is going to be the thumb. Yes, it is a finger. So if I could draw on this, let's say that I had an X right here and I had an O right here. Okay, the X would be lateral to the O because it's further from the midline. Now you'll see proximal, proximal, distal, distal. Proximal and distal, they're drawn along the limbs because they only are used when we're referring to arms and legs, including the fingers. Proximal just means closer to the point of attachment. So the further up the arm or up the leg you get more and more proximal. So if there was an injury and maybe there was a tendon that was torn just on the just distal to the kneecap, we would find the kneecap and we would go just distal, which would be right down here. If we were to say just proximal to the kneecap, that would be just right above the knee. So the hand, relative to the forearm, the hand is going to be the most distal part of the limb. The shoulder is going to be the most proximal part of the limb. Now if we take the subject and we turn them sideways, we get a couple of new anatomical terms. Ignore ventral and dorsal. Those are actually used for four-legged animals. So we use the word anterior when we mean further forward. posterior when we mean further backward. So if you'd want to describe the anterior surface of the leg, you would be talking about this surface of the leg right here. The posterior surface would be right here. So when I described earlier, point to I said the front of your forearm, we should actually be talking about the anterior of the forearm if you're in the correct anatomical position. And you can see the other ones here, superior, inferior, proximal, and distal again. The last one that we need to talk about is depth and superficiality. So if something is deep to the surface, from the surface, that means it's just further down in. So if you have a really deep bruise, that means it's not just some little black and blue mark on the surface. That means that that black and blue mark actually goes deep down into your tissues, and those are the ones that really, really hurt. If you ever heard of somebody having a deep bone bruise, you can actually have a bruise on your bone, and that's really painful. Superficial is just the opposite. It means closer to the surface. So the most superficial organ on your body is going to be your skin. The heart is one of the deepest organs in your body, and all the other things that are around it. Now, for the quiz tomorrow, what you're going to be looking at are questions that are similar to this. They might be fill in the blank. So the nose is blank to the eyes. The way that I wrote this, to the eyes, means the eyes are the reference point. And I'm asking you, where is the nose? So if my eyes are right here, you could use a couple of different words. You could use the word inferior. You could use the word, I hope you said medial. Or if I turn sideways, you can even see anterior. So those are three answers that I would accept. And most often I'll be expecting more than just one answer. Here's another one. Your hair sits on the blank surface of your head. You would need to just be able to say it is on the superior, lateral, posterior, and not so much on the anterior side. But still, you could use any of those words, or you could also say superficial because it's on the very outside edge. Now, if I were to say, what about a person that's bald? Well, most often, they're not going to have any hair only on the superior part. They'll still have it on the lateral and on the posterior sides of the skull. Another thing that I'm going to expect you to do tomorrow is if I give you a description, let's say I want you to put a mark on a body that is just proximal to the elbow on the anterior side of the arm. Well, you would need to know that proximal would be this way, just proximal to the elbow would be right here and on the anterior side of the arm. So you would need to find that spot on the body. But also, if I give you a structure, you need to be able to say exactly where that structure is using all of these terms that we just described. And you're not allowed to use the words top or bottom or front or back. You would have to use words like superior to something, inferior to something. Okay, and so remember, you always need to have what it is you're trying to describe and a reference point. I think that's it. I hope you study well, and good luck on the quiz tomorrow. See you later.